Good day, lovely people. It's another amazing episode on Health Zone, and today we are going to talk about stomach ulcer and what you can do about them. I know you are here to learn something, so please don't go away. Stay tuned. I'll go for a quick break. When I come back, we'll delve into the matter of stomach ulcer today. We'll be right back. Welcome back from that short break now. Stomach ulcers, which are also known as gastric ulcers, are painful sores in the stomach lining. So the stomach ulcers are a type of peptic ulcer disease. Peptic ulcers are any ulcers that affect both the stomach and then the small intestines. So you should know the difference between the small intestines and the stomach. The stomach ulcers occur when the thick layer of the mucus that protects your stomach from digestive juices is reduced. This allows the digestive acids to eat away the tissues that line the stomach, causing an ulcer. Stomach ulcers may be easily cured, but they can become severe without proper treatment. Now let's look at some causes of stomach ulcer. Stomach ulcers are almost always caused by one of the following: an infection with the bacterium Helicobacter, the pylori, long-term use of the non-steroidal anti-inflammatory drugs such as aspirin, ibuprofen, or naproxen, rarely a condition known as Zollinger-Ellison syndrome can cause stomach and intestinal ulcers by increasing the body's production of acid. This syndrome is suspected to cause less than 1% of all peptic ulcers. Now let's look at the symptoms of stomach ulcer. A number of symptoms are associated with stomach ulcers. This severity of the symptoms depend on the kind of ulcer that you have. The most common symptoms is a burning sensation or pain in the middle of your abdomen, between your chest and your belly. Typically, the pain will be more intense when your stomach is empty, and it can last for a few minutes or several hours or days. Now, other common signs and symptoms of ulcers include dull pain in the stomach, weight loss, not wanting to eat because of pain, nausea or vomiting, bloating, feeling easily full, bumping or acid reflux, heartburn, which is burning sensation in your chest area, pain that may improve when you eat, drink, or take antacids, anemia, whose symptoms can include tiredness, shortness of breath, or pallor skin, dark and teary stools, vomit that's bloody or looks like coffee browns. Talk to your doctor if you have any symptoms of stomach ulcer. Even though discomfort may be mild, ulcers can worsen if they aren't treated. Bleeding ulcers can also become life-threatening, so let's all take note of that. Now, how are stomach ulcers diagnosed? Diagnosis and treatment will depend on your symptoms and the severity of your ulcer. To diagnose a stomach ulcer, your doctor will review your medical history along with your symptoms and any prescription of over-the-counter medications you are taking. To rule out H. pylori infection, a blood, stool, and breath test may be ordered. With a breath test, you will be instructed to drink a clear liquid and breathe into a bag, which is often sealed. So if your H. pylori is present, the breath sample will contain higher than normal levels of carbon dioxide. Other tests and procedures used to diagnose stomach ulcers include the barium swallow, which is you drink a thick white liquid that coats your upper gastrointestinal tract and helps your doctor see your stomach and small intestines on an X-ray. We have the endoscopy. A thin lighted tube is inserted through your mouth and into your stomach and the first part of the small intestine. This test is used to Look for ulcers, bleeding, and any tissues that looks abnormal. Endoscopic biopsy. A piece of stomach tissue is removed so that you can be analyzed in a lab. Explore the interactive 3D diagram below to learn more about stomach ulcers. Now, treating stomach ulcers. Treatment will vary depending on the cause of your ulcer. Most ulcers can be treated with a prescription from your doctor, but in a rare case, surgery may be required. Very rare cases. It's important to promptly treat an ulcer. Talk to your doctor to discuss a treatment plan. If you have an actively bleeding ulcer, you would likely be hospitalized for intensive treatment with endoscopy and IV ulcer medications. You may also require a blood transfusion, which also requires a lot of process. Now, non-surgical treatment. If your stomach ulcer is the result of Ph. pylori, you will need antibiotics and drugs called proton pump inhibitors, PPIs. So PPIs block the stomach cells that produce the acid. So in addition to this treatment, your doctor may also recommend an H2 receptor blockers, drugs that also block acid production, stopping use of all NSAIDs. So follow-up endoscopy, probiotics, useful bacteria that may have a role in killing off your H. pylori. So this is some of the treatments that you can have. Now, symptoms of an ulcer may subside quickly with treatment, but even if your symptoms disappear, you should continue to take your medications prescribed by your doctor. This is especially important with H. pylori infections to make sure that all bacteria are eliminated for good. Now, let's look at some side effects. Some side effects also include nausea, dizziness, headaches, diarrhea, abdominal pain. These side effects are typically temporary, so any of these side effects cause extreme discomfort can help your doctor about changing your medications and all that can do to heal you. Now, surgical treatment. In a very rare case, a complicated stomach ulcer will require surgery. This may be the case for ulcers that continue to return, ulcers that don't heal, ulcers that still bleed, tear through the stomach, keep food from flowing out of the stomach into your small intestine. Now, surgery may include the removal of your entire ulcer, taking tissue from another part of your intestines and patching it up over to the ulcer site. So, tying off a bleeding artery, cutting off the nerve that supplies to the stomach to reduce the production of stomach acid. Now, let's look at some healthy diets that can help you. In the past, it was thought that diets could cause ulcers. We know now that this isn't true. We also know that while the foods you eat won't cause or cure stomach ulcer, eating a healthy diet can benefit your intestine tract and overall health. In general, it is a good idea to eat a diet with lots of fruits, vegetables, and fiber. That said, it's possible that some foods play a role in eliminating your H. pylori or boost the body's own healthy bacteria, include the broccoli, the cauliflower, the cabbage, and radishes. Leafy greens such as spinach and kale, probiotic-rich foods such as sauerkraut, the miso, the kombucha, yogurt, especially with lactobacillus, and the apples that will help you, blueberries, raspberries, strawberries, and blackberries. Olive oil can also be an additional intake for you. Additionally, since people with stomach ulcers may have accompanying acid reflux disease, it is a good idea to stay away from spicy and sour foods. Now, let's look at some remedies at home that can help with your stomach ulcer. In addition to eating healthy foods, the following items may help reduce the effects of the bacteria responsible for any stomach ulcers. However, These supplements are not intended to replace the prescription medication that your doctor has given you or your current treatment plan. They include probiotics, honey, glutamine. Food sources include chicken, fish, eggs, spinach, and cabbage. Your doctor may also have suggestions for things you can do at home to relieve discomfort from your ulcer. Consider talking to your doctor about any natural remedies you've heard of or someone has told you, aside the ones I have mentioned before. Why should you call or see a doctor? If you think you have a stomach ulcer, call your doctor. Together, you can discuss the symptoms and treatment options. If you don't already have a physician, you can also find out on the health line, online, on Google. You can do that. Find a tool to find a provider near you. It's important to get stomach ulcer taken care of because without treatment, ulcers can cause bleeding from the ulcer site that can become a life-threatening problem. Now, penetration, which occurs when the ulcer goes through the wall of digestion tract and into another organ such as the pancreas. Perforation, which occurs when the ulcers create a hole in the wall of the digestive tract. Abstraction, which is also blockage in the digestive tract, which is due to swelling in the inflamed tissues. Stomach ulcers, especially non-cardiac gastric cancer trusted sources, can also help with that. Symptoms of these complications can include those listed below. We have weaknesses, we have trouble in breathing, red or black vomit or stools, sudden sharp pain in your abdomen that doesn't go away. Now, to prevent ulcers caused by the NSAIDs, stop using these medications if possible, or limit the use of it. Be sure to follow the recommended dosage and avoid alcohol while taking these medications. And always take these medications with food adequate with liquid. This is where we end today's episode on Health Zone. I hope you learned something. Please comment in the section below. Let us know your thoughts. If you have any remedy at home, you can also comment below so that we will also learn about it. My name is Jennifer Amlade. Make sure you subscribe, hit the notification button so you'll be notified anytime we make a post. Thanks for watching.